Well, hi there. Good to see you right here on Health Diary. My name is Winnie Lubembe, and we're coming to you from Dr. Kalebi Labs right here in Nairobi. And you ask, why are you in a lab exactly? Well, we'll be focusing on a conversation on HPV DNA testing, and this is in relation to cervical cancer, which is the fourth most common cancer globally, with over 660,000 new cases and 320,000 deaths annually. So HPV DNA testing, what exactly is it and how is the test done? Well, let's find out after this fact of the matter.
The HPV DNA test is the most accurate screening method for cervical cancer. It detects the actual virus, human papilloma virus, that causes over 95% of cervical cases even before any symptoms or cell changes appear. So why does it matter? It identifies high-risk HPV strains, especially HPV 16 and 18. It can detect risk years earlier than pap smear. HPV DNA testing is your best chance for early detection and protection against cervical cancer.
All right, let's talk about HPV DNA testing. And if I'm being honest, this is a term that we all have had, okay? And by we all, it's most of us, okay? And this is as far as understanding what HPV DNA testing is all about. And even the bigger question is it happening here in the country? But not to worry, because by the end of the show, we'll get to understand what is it and how it is done and if the services are available right here in the country. And to help us with that conversation, I'm going to start on my far left, and we are joined by a very familiar face, if you ask me, and that is Dr. Ahmed Kalimbi, who is the principal pathologist and executive chair or CEO right here at Dr. Kalimbi Labs. Thank you for hosting us and good to see you again. And we also have Grace Irungu, who is a disease prevention and cervical cancer champion from Rotary International. Good to have you, Grace. Thank you. Thank you for making the time. Doc, can we just start with the basics? HPV. We've heard about it over time, but then again, when it comes to testing, and now we're looking at DNA testing, it's like a whole lot of things, right? So HPV at its very basic level, what is it and why is it such an important conversation to have?
So HPV stands for human papilloma virus. It's one of the many viruses that you know. It's actually a virus that is fairly common. Most people have had it, have interacted with it. It's a virus that causes warts, skin warts. You feel the skin warts can happen on the skin, genital warts. So it's a fairly common virus. There are more than 100 different types that cause different sort of like skin lesions, warts on the mouth and the rest. Most of them will tend to clear, and it's well known. Now, the HPV we are talking about is the one that particularly is known to cause cancer, and that's what we'll be discussing today. So when we talk about HPV, we mean human papilloma virus. And when you hear the word DNA, there are two types of viruses mainly. There are what we call RNA virus and there are DNA virus. HIV, human immunodeficiency virus, is an RNA virus. And it's called a retrovirus. Now this one, HPV, is a DNA virus. DNA and RNA, you know, they're the building blocks of life. So all living organisms will have either RNA or DNA. And in this context, HPV is a DNA virus. So when you talk about HPV DNA test, we are testing for the DNA that is found in HPV to say, is the virus there and which type is it? Okay. It's the same way you do a DNA, they say paternity test. So I'm actually taking somebody's DNA and comparing that DNA with a child. That becomes a test. So we are testing DNA, but not a DNA of a person, but we're taking DNA of a virus. So the HPV DNA test is a test of DNA for the HPV.
Okay, very well said. And again, we talk about HPV mostly when we're talking about cervical cancer, right? So can we talk about how important that is? What is this factor to really understand as far as HPV and cervical cancer?
So cervical cancer is the commonest cancer in our country next to breast cancer. But it's entirely preventable. And I'll tell you why. But most importantly is that cervical cancer, as you know, it will affect anybody with a cervix, which is mainly women. What we know now, and it was actually a Nobel Prize for the discovery, is that HPV causes cervical cancer. Let me repeat that. Cervical cancer is caused by human papilloma virus, HPV. Many years ago, when I was still in undergraduates in the and early 2000, when I was a young doctor, it was said some cervical cancer are caused by HPV, others maybe not. But now we know more than 99.5% of all cervical cancers are caused by HPV. There's a 0.5 that is not caused by HPV, but is not even a dangerous cancer. It's what we call minimally deviated carcinoma, which will not kill anybody. So all cervical cancer, and for the people who know about this, whether it is squamous cell carcinoma type, adenocarcinoma, these are all variants of cervical cancer. They are caused by HPV. How does the HPV cause the cervical cancer? It's very, very important for people to understand. HPV, by the way, is an innocent virus.
Okay.
Just like
like any other virus.
Any other virus or infection, you get a sore throat. I mean, the bacteria was trying to survive and you get infected. You got sick. So HPV is very ubiquitous. It's all over the place. But when it finds its way through the vagina into the cervix, if it infects what we call the transformation zone, there's a very thin layer in the cervix. If it goes and infects that area, it switches on certain genes. That's why you call it an oncovirus. It is a cancer-causing virus. It didn't mean to cause cancer, but it has a certain switch that it uses for its own self. Because what does the virus survive? It survives by multiplying your cells so that it can also multiply. Now, when it goes in and switches that to multiply so that it can also reproduce, they are what we call high-risk HPV. You'll hear that word a lot. HRHPV, which is high-risk HPV. It means they have this switch, which is very, very, what we call virulent. It is very, very powerful, and it will cause higher multiplication. So there are two main types of genes. I won't go into the details, but those genes, if they are found together, they make it high risk, and that's why we talk about HPV type 16, type 18, and there are 14 other subtypes. All these, they have this high-risk switch. The other HPV, more than 100, don't have this high-risk switch. So if that high-risk HPV infects the cervix starts multiplying. It undergoes certain genetic changes. And depending on the genetic makeup of the women, some will clear the virus, others will not clear the virus. The unfortunate ones who don't clear the virus, they are now at risk of developing cervical cancer. The last most important point is that it doesn't happen overnight. If you get herpes simplex, you'll get a skin wound, a blister. It's overnight, itauma, ipote. But with HPV, it is slowly, it builds up over time. It starts with what we call just multiplication of the cells. Then it goes ahead to become precancerous changes, then eventually cancer. And that whole process can take anywhere between 10 to 20 years. And that's why cervical cancer, you can screen. And traditionally, we have been screening using pap smear. So what does pap smear do? We go collect cells. We do what we call a speculum in the vagina, look at the cervix, pick cells, look at those cells under the microscope to see, are there any changes under the microscope? Those changes are caused by HPV. Now, because we know HPV causes cervical cancer, and we now have the technology to test for the HPV DNA, you test for the cause. If a woman is HPV negative, she has zero risk of cervical cancer. If a woman is HPV positive, high risk, she is at risk of cervical cancer, and it should be followed up closely. So that's the whole story about HPV and cervical cancer.
Yeah, it's very interesting because, you see, when we think about cervical cancer, we think about all this other thing, and HPV is sort of like the last one, for us to think about. And I'm also curious, Grace, from you, because you deal mostly with the communities, how much of awareness is there as far as HPV and its contribution or its role as far as cervical cancer is concerned, before we even talk about DNA itself?
Well, thank you for that. I think information is power, and that is a power that communities do not have. Even where I sit right now, I learned about HPV DNA 2-3 weeks ago in one of our webinars. One of the information stations that we have. So the information is not out there. I am with you in wondering who has it and how come we're not hearing about it. But the moment we got to hear about it, and this is really the work of Rotarians, is then put it out. So this forum is really to get us to understand that HPV DNA testing is available. It is here where we are. We don't need to go too far to get it.
Yeah.
And that it is a solution that we've been looking for. So in terms of how much do communities know about this, I don't think it's too
We
much.
found out, like you said, just recently, and to be in spaces where ideally you should have this information. So Dr. Cliff, it's a lot of work for you, yeah?
Somewhat.
I'm very surprised, to be honest, because I was actually one of the first labs or rather lab scientists to do HPV testing routinely. At the time I was in Lancet, that is in 2016, when FDA approved HPV testing for cervical cancer screening. We introduced it then and we started popularizing it. And in 2019, the Ministry of Health made it part of its guideline that you can do HPV testing for primary cervical cancer screening with pap smear as an alternative to pap smear or what you call VIA. But from 2024, that's last year, the Ministry of Health guidelines has now said HPV is the recommended testing for cervical cancer screening. And the advantage is you can do what you call self-sampling. So the women don't have to go to a facility to be seen by a nurse or a doctor to have a pap smear. Women don't like it.
No.
You can actually have self-sampling using basically a swab. Looks almost like an earbud, and I'll show it later. And self-collection. You collect the sample because you are looking for the virus. I'm actually surprised you guys didn't know about it. And sorry to say this, but none of you guys have actually done the test. So before you leave here today, you must do the test.
We will.
You must do the test. But many women just don't know, even doctors. And I think the problem is, for a long time, we've always thought about HPV testing as some esoteric, rare tests. Yet it's quite available. It's literally cheaper than a pap smear if you look at it from an economical perspective, and we can discuss that. But it's actually available. It can be easily done.
Yeah. Grace, there's also this thing that we've seen among women, and probably you might tell us based on your interactions with the community, in terms of I'd rather not know than go to a hospital and get told, hey, sasa, kuna hii video iko, okay? So what are some of the biggest fears that probably women have told you as far as just getting tested, either pap smear or HPV DNA testing?
All right. I think one of the biggest fear is if it tests positive, this is a death sentence.
Okay.
So there's this act here that I'd rather not know, and I feel fine, so I believe I'm fine. And I'd rather not know. So I might go and I'm told you're HPV positive, whatever that means.
Yeah.
And it means it's untreatable, it's a death sentence, I'm dead, you know. But also number two is a stigma that comes with it. And I like the way that Terry has explained, because there is the notion that I have an unclean past, you know, and so the community, then you have that, the stigmatizes you. Your husband, usually, or your spouse, then begin to think you've been out there, you've been with many people. So there's that notion. But another one then really is access to the test and the cost, real or perceived, and that we think if this gets there, what is the cost of treatment, or what is the cost of the testing and the screening? So yes, we have women who are just doing the regular PAPs and thinking, I've been fine. Last year I was fine. The year before I feel fine. I may not need to go beyond this. And we saw this a lot in the webinars that we conducted. So a lot of questions that came up, even then sent later after the webinars were done, were number one, this HPV DNA testing is unknown to a lot of women. So there was a lot of questions about what is it, how is it done, and all that. But also, what does a positive test mean? Is it a death sentence? So I think these fears are part of pretty much bottom line information.
Yeah, that is not there.
Yeah.
All right. So Grace, still on women, right? And the fears. You've also conducted a lot of webinars on HPV. Why was there a need to have this conversations over and over? And what are some of the things that came out from the webinars?
Okay. Let me take us back a bit. So Rotary is this network of colleagues and friends and neighbors and all that who are volunteers, and they just come together to help sort community issues. And Rotary does this through 7 strategic areas. So there's environment, promoting peace, providing water. But one of the key areas of Rotary's interventions is disease prevention and control.
Okay.
So in this area, we have a lot of initiatives run by different action groups. We have an action group called the Rotary Family Health Days. We have our Rotary district, Kenya, Ethiopia, Eritrea, and South Sudan. And there are a lot of projects by Rotarians that address diseases in terms of prevention and treatment. So the major outreach program is medical camps. And anytime you're doing medical camps, you partner with the local health institution and they tell you what are the main things happening in this area.
Okay.
So that when you take a sponsor medical camp in that area, you're addressing the needs of that community. So cancer screening and cancer testing has been on almost every list we have received anytime you want to do a medical camp.
Okay.
So the women do not have access, they do not have information, and they want to know what's happening. So this is what has informed the webinars. And we have had webinars over the last maybe 2 or 3 weeks that specifically on the cancer of cervix.
Yeah.
Questions have arisen a lot about testing, about screening, about our daughters, about our mothers, and pretty much everybody has a story. Somebody you've lost, somebody, something that has happened. So it is a real need in our community.
Okay.
So really the reason why as Rotary we are taking this with the interest that we are putting in is because it is a real need in our community. It is a question that women are asking, and the least you can do is provide an answer.
I see.
So,
Yeah. And also when you talk about testing and screening, majority of the times it's usually the cost a big factor and a big scare for so many people. But we'll talk about it later. Doc, for now we just want to understand. So then, how often should people test for HPV, DNA testing, and what are some of the factors that to consider when you're thinking about testing and how frequent?
So people know historically about pap smear.
Yes.
So I have to also mention about pap smear, why there's been moved from pap smear to HPV testing. Scientifically, HPV DNA testing is much more accurate. We call it sensitive. It can pick even very low infection, and it is a better prediction of who is going to develop cervical cancer if not treated. The problem for pap smear, it is not entirely accurate and sensitive.
Okay.
It can miss up to 40 to 50% of cases. So if you do a pap smear, first of all, women don't like it because it is very invasive. The speculum, a lot of them complain about the speculum, the privacy. Not many women will go and encourage other women to do it and they don't want to go back to it. Most women actually will do pap smear because they have some other symptoms. Maybe they have vaginal discharge, pain and all that. But through screening, the uptake has been very poor. And that's why HPV has become very handy because of the self-collection.
Okay.
Now, pap smear, we used to do it annually to every 2 years. Why? To increase the sensitivity, the pick-up rate. Because it can miss up to 40 to 50% of precancerous changes.
Okay.
So you are doing it every year so that it can pick. Because if you miss cells, you might miss them under the microscope. But with HPV, if the HPV DNA is positive, that's the woman you'll follow. So I actually have prepared it.
You came prepared.
I came prepared. I said, he does not show grace. This one I had to show grace particularly. Yeah? So this is actually a swab. It comes in a sealed container. Let me give you to all this. I come through so that you can appreciate it. And I'll use this one to demonstrate.
Okay.
So this is actually the swab.
Sterile swab.
It's like, so it's sterile because nothing has touched it. It's absolutely clean and it's sealed.
Yeah.
Okay.
Before we used to have other gadgets that you had to manipulate. But now we know this is very, very sensitive. It can pick HPV even better than even doctors collecting samples for pap smear. Okay. And how it works is like an earbud. It's a bit longer. And when you get it, basically open it. So now I've opened it, I've broken the seal. Okay. So that's it. It's literally an earbud. Yeah, but you're not supposed to put anything in your ear. Now compare this to the speculum.
Yeah, okay.
How it literally works is once you have it in your hand, I mean, you don't even need to like wash the hand. I mean, just like you go to the washroom and literally insert it into the vagina.
Okay.
Push it in. It's a short thing.
Yeah.
Push it as deep as you can without hurting yourself. You can koroga it kidogo, a few seconds. That's it.
Okay.
Then where is my container?
Okay.
Take it back, cap it, andika jina. We shall give you a bag ready. I'm ready. Give you a bag, put it,
Drop it in.
seal it. Usually there'll be a request form and an envelope. Seal it inside. You can mail it to us. You can drop it at the lab. So literally this is something you do as Rotarians or campaigners.
Yes.
You actually can take like 100, 200, whatever number, dish it out like lollipops.
Yes.
Yeah.
Yeah.
And you literally just need a washroom, your office. Ama enda huko Jumatatu.
Thank you.
How long by the time someone takes the swab, the results, it gets to the lab, like how long would that
Now, this is one of my favorite statements to make. So, for as long as this thing is intact, it has not melted, it is dry, it can even stay 6 months, 1 year. Don't have to hurry to bring it. Because it's HPV DNA. DNA is very hardy.
Yes.
And once it's dry, itabaki tu hapo. So you can literally go this, when you're going to Christmas, mukana family gathering, beba kama vile nilikuwa nimebeba yangu. Patia wewe kila mtu aende hapo. Mutapatie na beba kuja. It's kind of like lollipops. So you can give them a lollipop plus this.
Oh, fantastic. And so there's no specific conditions of you keep it in a cold, dry.
No. As I say, as long as the plastic here is intact, Niger melt, it has not melted.
Yes.
If it comes to the lab, it is.
That's fantastic. And then upon it getting to the lab, how
So when it gets to the lab,
will I get my result?
when it gets to the lab, basically what we do, we break this off. There's a container, we put it. There's a liquid we get to elute, to basically dilute, remove the virus, and then we test it. It literally takes 3 to 4 hours. So in our lab, for example, we run 3 times a day, morning, afternoon, and evening. So if you brought a sample in the morning, by afternoon you have your results. If you brought it during the day, by evening you have a result, or the next morning.
Okay. So depending on, and I know we need to end the show, but depending on the results, say if the results are positive, what are the next steps?
So the test detects whether there is HPV present or not. If it is present, we say it's HPV positive. Now, there are tests that will say positive or negative without saying which type. But what we do here at Dr. Kalebi Labs, we use a Roche platform. It will actually tell you the genotype, the subtype. It will tell you is it type 16, 18, or one of the other 12 subtypes. If it is positive, type 16 or 18, that woman goes straight to a gynecologist for colposcopy, where the gynecologist will now look properly at the cervix to see if there's any precancerous lesion. If there are, take a biopsy.
Okay.
If it is the other 12 subtypes, the Ministry of Health guidelines is they should also go for colposcopy or VIA, where the medical practitioner will look, and if there's any lesion, treat. Now, if there is no lesion, no wound, nothing in the cervix, then after that they go for annual pap smear if they're HIV positive, every 2 to 3 years if they're HIV negative. So a HPV positive puts you on track to now be followed up. And the reason is you want to be followed up early to confirm you don't have cervical cancer. And if you have precancerous lesion, the cervix, the part that is small affected, will be removed. If you wait too long, the whole cervix will get affected. It will affect the uterus, and you can literally die of cervical cancer, or the operation will be much worse. So to answer your point, when you said women are afraid, they don't want to know. Why would you want to know you have a problem so it can be treated? You want to know you have a problem because cervical cancer, of all cancers, is the only cancer that can be 100% prevented and treated, picked early.
I see.
Cervical cancer picked early, what we call cervical intraepithelial neoplasia, CIN. If it is picked early, between 5 to 15 years before it develops, you literally can go and have it cured, because all you need to do is just remove that small part where it starts before it spreads.
Okay. Chris, we'll allow you to go do your test, right? As we say goodbye.
So you've understood. You've understood exactly.
Yes.
Yes.
Are we allowed to ask a few questions?
Sure. Ask all your questions. I'm sure they'll find a way.
At what point in a woman's menstrual cycle you are when you're doing this?
Not really. Because if you're menstruating, there's blood. If HPV is there, it will mix with the blood. the thing will be bloody, but the HPV is there. But of course, you don't want to do it when you have a heavy flow because of the washout effect. So you don't want to do it when you have a heavy flow, but otherwise, anytime.
Anytime. It's a pick and go.
Si utafanya na utaniambia.
All right. No problem.
Hebu seka hili sababu just pretend you're opening it. You can rehearse.
All right, we can rehearse.
Yes.
So she's rehearsing the opening. Okay, she does that. Hey.
Unaigiza.
And Doc, will you speak on the cost? And is it covered by insurance?
Yes.
Russia,
So the cost has also significantly come down across most labs. In our lab here, we charge basically 5,690. We try to make it very affordable. Many years ago, it was like 12,000, 14,000. A SHA covers and pays for it for any prescribed test by a doctor. So you need to have to go to your doctor and say, and it's actually completely covered because it's part of the key pillars for SHA, cervical cancer. Now, it's supposed to actually become ubiquitous, as we say. Any woman can go and have the test done every 1 out of 10 years by SHA under the primary health care.
Yes.
But it has not really been rolled out. For civil servants, it's 100% covered.
Okay.
All insurances in Kenya cover HPV testing.
Fantastic.
And a lot of people will say, HPV, this one is like 3,900 versus pap smear, which is around 2,000. It's more expensive. But pap smear, you forget there's a cost of the healthcare worker. Here, you don't have the cost of the healthcare worker. You need a couch. You need a speculum. Pap smear can take days for you to get the results. And it's not as accurate. This is much. And pap smear, you have to do it every two years.
Yeah.
So in 5 years, you'll have done, in 10 years, you'll have done times 5.
Yes.
Which means
so
the cost is more.
Yeah.
And this is much more accurate. And women, all women who have tested HPV with this, they get a good experience. They'll go and encourage their friends and their neighbors.
Yeah.
No woman will encourage a colleague to do a
To go a pap smear. Yeah.
And that's why you'll find in the UK, they have completely switched to HPV. Australia, a lot of states in America. It is the way to go. And it's actually the current Ministry of Health guideline and WHO guideline and what we call Federation of Gynecologists guidelines. So it is the way to go. The future is now.
I see. The future is now. And literally, we do not have any excuse whatsoever. Okay. So HPV DNA testing is what you need to be thinking about. And especially if you're thinking about getting someone a Christmas present. Okay. Even as we head towards
Like a lollipop.
season. Like a lollipop. I see that. Well, thank you so much. Carrie, Dr. Kalebi, thank you so much, Grace. All right. Time now for you to take a look at this health tip as Grace goes for her testing.
All right.
Let me get you the envelope. These are not big. Okay. So come with me.
On today's health tip, do not go to the pharmacy to buy antibiotics without knowing what you're treating at home. Go to the nearest health center to get a correct prescription for the disease that you want to treat.
All right, guys, I am done with my tests. Here it is. So I am just going to put this in a bag over there and then put this in an envelope. All right, there it is, done. Less than 5 minutes and you have your sample collected. And that goes to show how important it is for all of us women to really consider taking a HPV DNA testing for everybody, your sister, your mother, your grandmother, your wife, for the men. Ensure that we all get HPV DNA testing. My name is Winnie Lubembe. Enjoy the rest of your day. I will see you next week on Sunday. Let me take this to the lab. See you.